And good evening, and welcome to this episode of the Your Health is Important Ask Dr. MJ Facebook Live, Instagram Live, YouTube Live broadcast where you, the listener, can tune in and ask your healthcare questions. We are live in the studios of Atlanta West Primary Care, and we're here to be your infotainment resource. So remember, it's been a few weeks since we've been on. We had a marvelous guest host last time, Dr. Marlon Stinger B. Jackson, dentist to the stars, my personal dentist, and he took full advantage of that. And I heard he had a wonderful show. So that is great and good. And we are glad that you have chosen to be here with us tonight. So I start off with talking about the topic that I spoke about this morning on Wellness Wednesday on the Rickey Smiley Morning Show. One, we talked about throat cancer. Throat cancer is one of is just growing in its efficacy. I have multiple patients in my practice now that suffer from throat, head, and neck cancers. So these cancers are cancers that we can do something about and we can help to try to prevent. One of the fastest growing cancers is often linked to the HPV or human papillomavirus. Guess what? Dr. Collier thinks that most cancers are linked to viruses. We just have not had the desire or the capability to make those diagnoses. But I think that when they look at most cancers, if they actually look at them, say like an electron microscope, which is not readily available, I think they will find that a lot of cancers have viral complements to them. The Epstein-Barr virus has been associated with multiple infections, and the herpes virus as well, and now the human papillomavirus is a definitive link to certain types of cancers, particularly cervical cancer in women. And so throat cancer, now one of the fastest growing cancers, again, is often linked to the HPV virus. Oropharyngeal cancers in the head and neck are divided into two categories, basically. So those that are associated with the HPV virus and those that aren't associated with the HPV virus. So we want to make sure that you're looking at those categories. So 3 ways you can reduce your risk of getting that cancer. 1, tobacco and alcohol use. So if you smoke, don't smoke, but also don't use tobacco packs, the little pellets that go in your mouth between your cheek and gums. Don't dip snuff. Don't use chewing tobacco. None of those products, they all predispose you to getting an oropharyngeal cancer. And it's a very rare entity for people that don't smoke or use those types of tobacco products. And alcohol use, amazingly enough. I'm not sure what type of alcohol is associated with this, but my personal recommendation is that 1 or 2 cocktails a day is good for you. And it doesn't matter what it is. In my opinion, there's no such entity as light alcohol. So you can't say I just drink a light beer. I think a serving of an alcohol is a serving of alcohol. So 1 beer is equal to 1 glass of wine is equal to 1 shot of Jack Daniels or Crown Royal or whatever you like to drink. So I think drink the beverage of your choice. But for a gentleman, 2 cocktails a day is recommended. For ladies, 1 to 2, depending upon your size, weight, and age, and body fat composition. But there are definitive benefits that have been determined by alcohol in moderation. However, alcohol is a poison. And if you take a poison in excess, then it will act like a poison does and give you some definitive changes. So we go to alcohol consumption in moderation to help prevent the throat cancer. So what's important is that they are very different biologically and are treated differently. But the traditional therapies for any type of cancer, surgery, radiation, chemotherapy, are all appropriate in this situation. And it's better to reduce the infection risk of an HPV virus. So 3 things you can do: no smoking of tobacco, no chewing of tobacco, no snuff, no tobacco pouches. 2, minimize alcohol or alcohol in moderation only. And 3, and finally, the HPV or human papillomavirus vaccine. Now, when this vaccine first became available, they were only offering it and recommending it for adolescent kids, basically children they would hope to get it before they reach the age of sexual activity. So they recommended that kids get it about age 10, 12, something like that. And so then, from a common sense perspective, people don't stop having sex in adolescence, or they may start having sex, or they may have been in a monogamous relationship, marriage, and then got divorced, or they're widowed or widower. And so they resume the sexual activity and putting themselves at risk. So now pretty much the recommendation is that anybody should get the HPV virus if you are in that category. So lastly, it's always recommended to eat a healthy diet comprised of whole foods and trying to minimize eating processed foods and refined sugars. So That's where we are with that. That's the topic of the day. But again, this is your show, the People Show. Let's do our countdown highlight. Let's see who's on and who's listening right now. Winnie King. Hi, Winnie. Thank you so much for coming back. We missed you last time, but we're glad you are here today. Thank you for tuning in. Okay, Raymond Hislip. Hi, Raymond. Thank you so much, man. Every gentleman that tunes in is special to me. So thank you for being a listener. Miss McKeever Bowling, good evening. And thank you so much. Miss McKeever Bowling, I got something special for me. Give me a call offline and I'll talk to you about it. Sherry Gamble, good evening from Dallas. Thank you so much, Sherry. We appreciate you tuning in. I understand the weather in Dallas is crazy right now. They're expecting tornadoes or something, so be careful. Glenda Everett, good evening from Warner Robins. We are so glad to have you from Warner Robins. I told you I have friends, I have family in Warner Robins, and we hold Warner Robins somewhere special in our heart. Okay, Mimi Witcher. Hi, Mimi. Thank you for tuning in. Hope you're local, but you commute back and forth between here and Tampa. So thank you for tuning in and taking your time wherever you are to be with us tonight. Jarvis Matters from Macon, Georgia. Hi, Jarvis. Is this your first time tuning in? It may be. So we are glad to hear from you as well. So thank you very much. Okay, Dr. Marlon Stinging B. Jackson, thank you so much. We appreciate you for tuning in, and we're going to have you back in the studio very soon because everybody wants to have those dental questions answered as well. And having been with you for the last 20 plus years, I can answer a lot of them, but nobody does it like you do. So thank you, Dr. Marlon Stinging B. Jackson, Atlanta's best DDS. Okay, Sean Big Time Green, the first male follower that we had and always doesn't miss a show. Sean, thank you so much, and we hope that you're sharing this information with your friends when you gather, when you're playing cards, when you're hanging out. Don't just hold this information to yourself and tell your friends to tune in. I'm going to challenge everybody right now. Tell your friends and somebody that you know. We're very easy to reach. We're directly linked to the LipoDrops website, but you can go on all social media at AskDrMJ, Ask Dr. MJ, and we can tune in too. Don't keep it a secret. Don't keep it to yourself. But even when you share it with your friends, let them know that they can tune in as well. Robin Brennan. Hi, Robin from Waldorf. All right. Thank you so much. That's a sharp picture you got there. I like that vehicle. Okay. So let's get to it. Sharon Fife. Hi, Sharon. This is BJ from Norfolk. I want to know what is good for cholesterol and cold fingertips. I noticed that my fingers have been very cold in the last few days. So, one, for cholesterol, we have products on the LipoDrops line. You can get our omega-3 fish oil, which lowers total cholesterol, increases HDL, the good cholesterol, lowers the LDL, or low-density lipoprotein, the bad cholesterol, and lowers your triglycerides. Our omega-3 fish oil product is very unique in that it is purified. It doesn't smell fishy. It doesn't taste bad. So you can take 2 of those a day, and that will address some of those issues. Now, if your fingers have been cold, that could be a variety of things that need to be evaluated. If it's just been going on for a few days, it's probably just going to be passing. But of course, the simple things, you can put your fingers and your hands in warm water, dip them in there. That will make the blood vessels dilate and warm your hands up and keep them warm. But there's a phenomenon in a disease state called Raynaud's syndrome. In that Raynaud's syndrome, the blood's cut off in your distal extremities, your fingers and your toes, and it makes them turn purple, but they also get cold because there's no blood circulating. So we want to make sure and check you for the Raynaud's. That can be associated with a variety of different autoimmune disease states. So if they're just cold, that's one thing. If they're cold and turning blue or purple, then it needs to be evaluated. So I would follow up with your primary care doctor or just have it evaluated. This is not urgent or emergent. Just the next time you go, you want to get it evaluated. Make sure you share that with them. All right, Sharon Fife, thank you. Cheryl Bolden, my husband's being attacked with esophageal cancer. What vitamins or boosters do you suggest to strengthen his immune system while he's undergoing radiation and chemo? Oh, Cheryl, I'm so sorry to hear about your husband. Esophageal cancer is a booger bear, but it can be treated and oftentimes successfully. So the things I would also recommend are probiotics, which are good for general overall immune health, our omega-3 fish oil, and our vitamin D at 5,000 international units per day. Usually the first thing that happens when a person is diagnosed with a cancer of any type is that they place the person on vitamin D therapy. If they have not, then you want to get the vitamin D that we have. So we'll take those products that we mentioned. Those will all boost your immune system. Our LipoImmune is perfect for that, because also while he's being treated, his immune system is being challenged and he's at risk for various types of infectious pathogens. That means he's susceptible to viral infections like the flu and the coronavirus, bacterial infections like strep throat and pneumonia, And fungal infections, the things you don't think about, like toenail and fingernail fungus, jock-itch, athlete's feet, all those things are things that you're susceptible to while undergoing those types of therapies. So radiation chemo in particular. So we want to make sure that his system is optimized. These products are also perfectly compatible with any other therapy or any other medication that he's on. They are supplements and they are compatible, so there's no question about whether they're safe to take. In addition to, not instead of, in addition to the treatments that he's getting. Good luck with that, Cheryl. Please keep us informed as to your husband's progress, and we'll keep him in our prayers. Thank you so much for tuning in. Secunda Batty, black woman, 55 years, great health, very good. What can I use for dark circles under eyes? I'm light skinned, have to use makeup to cover it up. That is a problem that we all suffer from. Dr. Collier suffers from it myself. One of the things that's very simple that you can do is, one, make sure that you're drinking enough water and that you remain hydrated. But there are various types of products that don't just conceal, but that also help improve the circulation in the area under the eyes to take away that congestion, that blood congestion, basically, in doing so. I know you've seen pictures on television and in the movies and things of people laying back and putting the cool cucumber slices on their face. That's the reason that they do that, because it changes and compromises the circulation there, and it helps with that. So cold compress, they have facial masks as well that you can put in the refrigerator or the freezer even. With the refrigerator, I don't want you to put anything frozen on that sensitive area there, but a cold pack that has holes cut out so you can see your eyes, you can see, is also a very good way to do that. There are various types of products that are available. I would Google products for dark circles under the eyes, and some of them are a total waste, but some of them actually have been found to work. And just try something that you find that works for you. I have a product line that I use myself. I won't promote them, but it is very effective in relieving the puffiness under the eyes and the dark circles as well. And make sure you're getting enough rest as well. You need to get 6 to 8 hours of sleep every night. Most of us are getting about 4 to 6, and that's just not enough. But we stay up to midnight watching television or doing whatever it is we have to do. And the universal wake up time is 6 a.m., 6:30. And then so we're not getting enough sleep. So we're chronically and systemically sleep deprived. And also, if you lie flat on your back, that allows that fluid to drain. If you lay on your side or on your face, then you're going to have fluid collection just from gravity. And when you wake up in the morning, you're going to be puffy faced. So it's important that you also give that fluid a chance to resolve itself. So if you lie on your back, and if you have an adjustable bed, you can raise it about 15 to 30 degrees as well. That will help promote natural lymphatic drainage that will improve those dark circles under your eyes. Great question, Ms. Batty. We appreciate you. Okay. Donna Scott, 57-year-old female, postmenopausal for 12 years. Wow, you started early. Started my menstrual cycle, so I had the D&C. What can I do to get rid of the strong smell from my vagina? Okay, we got some problems there as far as the management of your bacterial flora. You need some good bacteria down there. This the bad bacteria that is foul and smells badly. You also want to make sure you're not getting any contamination directly from the rectum. So as grandmama used to say, you wipe from front to back and you take a swipe, do not go back and forth. That will relieve any bacteria that's down there. Probiotics would be amazingly good for you. There is one thing that I would recommend that you use, a betadine vaginal douche. And there are people that don't recommend douching, but in your case, you need to do that. Betadine it's an antibacterial, antiviral, and antifungal. So it kills everything in there. That's what you want. So you start off with a clean slate. Then you take the probiotics, like our lipobiotics, orally. They go in your mouth, and they will get through your circulation and get down there and help give you a positive bacterial flora in your vaginal area, and make sure. But also you want to check and make sure that there's nothing retained inside the vagina. Sometimes that can happen, and that there's no other problem. So if you have not had you had the D&C, you have not had a routine pap and pelvic, make sure you get that from your GYN as well. Great question, now. Raymond Heaslip, is it safe to take 4 different medications at the same time? It depends on what those medications are, Raymond, but most medications are compatible. In other words, you can take them together. What the important caveat is that you take enough water to dissolve those medications. You take a 1 pill, full glass of water. It takes about 2 minutes to dissolve that pill get it out of your stomach and into your system. So you could do it that way. You could take one pill, glass of water, one pill, glass of water, probably a half a glass of water if you're taking 4 different ones. And so 2 full glasses of water in total. You take it, you wait a few minutes, and just make that a part of your regimen during the daytime. When Dr. Collier is taking his supplements, again, I take every day the probiotics, the omega-3 fish oil, and the vitamin D. That's 3 pills. And so I could put them all in my mouth at one time, but I don't. What I do, I wake up in the morning, rinse my mouth out, take a pill. I brush my teeth, gargle, take another pill with a full glass of water, and then shave and take another pill with a full glass of water. So that way, each one has some independent stomach time, which optimizes its absorption. And then I've gotten water in too, and that's very important that you start the day off by getting some water in. I can get up to 2 full glasses by doing so. But to answer your question, most medications are compatible unless they specifically state not to do it. And again, take your medicines with water, not Coca-Cola, not orange juice, not grapefruit juice. Sometimes those types of products can have a negative effect on absorption and efficacy. In other words, they stop the medicine from working or they minimize what it's supposed to do. Water works 100% of the time. Just make it a part of your regimen. Again, I recommend there's virtually no medicine today that you have to take with food. There are some that you do, but the vast majority of medicines, as long as you drink enough water, you won't have any problem digesting it because it'll be out of your stomach and into your system. The biggest problem that we have, Raymond, is that most people take a pill, they take a sip of water, they take the pill, they take another sip of water, they may take a third sip of water, and then they throw the rest of the water back into the sink. So what they have now is sitting on their stomach is a wet, gummy pill that's going to be very difficult to digest. Your stomach responds to this by kicking out excess acid, trying to digest that pill. So now you get nauseated, you get a bad taste in your mouth, and you feel like the medicine doesn't settle on your stomach well. And it doesn't, because you didn't dissolve the pill by drinking enough water when you did so. So try a little experiment. Take 2 glasses of water and take something inexpensive like an aspirin. You fill one glass up with about 1 inch of water and fill the other glass up all the way to the top. And put 1 aspirin in each glass. You don't have to shake it, stir it, or anything. Within 2 minutes, the one in the tall glass will be dissolved. That's just the physics of dissolution of the medication. The other one will be sitting against the side of the glass waiting to dissolve. You got to stir it and all those other things. So that's just something simple. And one of the caveats, I call those clinical pearls. And I tell all my patients to do that because it optimizes your medicine when you're taking it. So Raymond, that's the answer to your question. Thank you. Great question. Practical, and everybody can listen to it. Earl Francis, is there medicine for prostate cancer 4x4? Yes, one, for any cancer, there are various types of medicines. There are actually some biologics now that target prostate cancer. These are prescription medications, but as far as supplements are concerned, again, the things that Dr. Collier recommends, my probiotics, my omega-3 fish oil, and the vitamin D at a therapeutic dose of 5,000 international units per day. Those will help with vitamin D has been shown to do so many good things with prostate cancer and colon cancer and breast cancer, etc. But the omega-3 fish oil is good for cardiovascular health, and it just helps in so many ways. It's a good, natural anti-inflammatory, and then probiotics are good for calming down your immune system and directing the immune system function, because your body, all the treatments for cancer, the traditional treatments require your body to clean it up. So radiation, chemotherapy, your immune system is a very important part of how you take care of a cancer type of diagnosis. So the answer to the question is yes. Those are supplements that I recommend to take and add to your treatment regimen. Of course, natural foods as well, eating clean. Tomato-based foods are very good. Tomatoes proper are very good. The lycopene in them is very good for prostate cancer in particular. So do a little research on that, clean eating and eating to cure and treat prostate cancer, and then the supplements that I mentioned earlier. Okay, Earl, great question. Sheila Thompson, what's your take on metastatic breast cancer? Well, metastatic means that it's no longer just in the breast, that it has spread to other places. What's amazing, the most common areas are like the backbone, and then down the lymphatic system. It can go below the diaphragm and affect the liver and a few other things. You get a biopsy of that. You got a tumor in your liver, you find, and they look at it under the microscope, and guess what? It's breast tissue. That's how they know that the primary cancer is breast cancer. And so they do a biopsy of the backbone, and they find that it's breast cancer that has metabolized it. And it goes through the bloodstream. It can go through arterial flow to capillaries where it will set up shop and start growing. It can go through the lymphatic system. So metastasis proper is much better to have an isolated cancer that's encapsulated, because you can remove that in toto, then you're cancer free. If it's metastatic and spread out, you have to use treatment options that will take care of cancer no matter where it is. That usually means systemic therapy, such as chemotherapy. Radiation therapy is usually focused to one area. Now, if you got a close metastatic area, they might use radiation on that as well. Biologics now that are utilized to treat breast cancer, and they're specifically for breast cancer. And these are medications that target the reproductive capability of a breast cancer cell and stop it from growing. And then your body's immune system literally cleans it up. So, and the thing is, that doesn't do damage to normal tissues. So unlike radiation and traditional chemotherapy, which do damage to normal tissue, the objective of those treatments is to do more damage to the cancerous tissue and have enough normal tissue left over to survive and thrive. Sometimes that doesn't happen. But with some of these new biologics, and that's what you need to Google and find out, biologics to the treatment of various types of cancers. I know, but there's particularly medications for metastatic breast cancer that you can utilize. Unfortunately, very expensive, but most insurances will cover them. You might not get it the first time you ask for it. And you also have to make sure that you are partnering with your physician. They might not offer it to you. They may assume either you can't afford it, don't want it, or they want to treat you the traditional ways. And that's one of the biggest problems that we have in the house of medicine, that oftentimes doctors treat patients the way they have been trained to treat. So they may not like to use the new methods because they're not used to it. They never use them. They don't want to start using them. So you have to make sure that your doctor is using state of the art. A cancer diagnosis is one where you need to be your own advocate, and you also need someone else that's clear mind and, and has time, energy, and effort, and a good ability to search things out on the internet, etc., and find out treatment options that you may not be aware of. And, there's literally sometimes a disinformation campaign by certain payers. They don't allow the doctor to tell you about some of these things because they don't want to have to pay for it. So they give you the traditional therapies or some therapy, not necessarily the best therapeutic option for you because of the economics of treating a cancer patient. So that is a reality in the world of medicine. So again, but if you present with them, you say, oh, I know this and I would like to try this, then you'll find you might have a much better outcome. And also, again, for metastatic breast cancer, you might be available to participate in a clinical trial where they have new and phenomenal medications that they use to see how well they work. And most of the time, they're in secondary and tertiary stages of the clinical trial. So you're not being experimented on. They know exactly how it works and what its side effects are, etc. They just need people to show that it does work. And so that's one of the other things. So clinical trials, one of the things you should investigate, and then also be your own advocate to find out everything you can about breast cancer. Get it staged, get the type, because there are various types of cancers, some more aggressive than others. But regardless of which yours is, you want to know what type it is so you'll know how to treat it and control it. Great question. Amber Mallory, is there anything I can do for PCOS? Maybe add hormones or something? Absolutely, Amber. Amazing enough, PCOS or polycystic ovary syndrome is a very common phenomenon, and the primary treatment is actually a medication that's primary indication is the treatment of diabetes. That medication is called metformin. Metformin is a diabetes medication, but they have found that it has wonderful benefits in disease states such as polycystic ovary syndrome or PCOS, as well as anti-aging. In my anti-aging facility, we use metformin because it slows down cell growth and cell aging on a cellular level. But you also could benefit from GLP-1 therapy. Some of these injectables that you're hearing about, like Ozempic and Mounjaro, are very good for PCOS symptoms and symptomatology as well as some other medications that are for diabetes proper that will help with that. So the thing is that the most common treatment and the easiest to do is to take the metformin, but then you also want to make sure you're monitoring your weight and get your weight down. That's where some of these other medications will come in. If you're not diabetic, and PCOS is a diagnosis that might get you the medicine, but if it's not, then some of the other drugs like Wegovy and Zepbound are indicated only for weight loss, and that weight loss because it changes the amount of fat that you have, which changes the amount of hormones metabolized by the fat, and helps improve those symptoms of polycystic ovary syndrome. The main thing is you can get hirsute, which means it gives you mustache and facial hair growth, but it also can give you an increased abdominal girth or abdominal fat. And also you can get the saddlebags, the outer thighs can start to accumulate fat as well. So all of those things, it makes it sometimes difficult to conceive or get pregnant. You can address all of them by doing that. Hormonal therapy is also an option. And it's not the final option. It's one that I might implement early, depending upon a variety of things, such as your age and your childbearing capabilities, whether you want to have children or whether you've already had them and you're through with that. That opens up the door to other therapies as well. Great question, Amber. We appreciate you for tuning in. Demon Wilson, or Demond, 509. The sea moss in the morning good for glucose level. Sea moss is good in the morning or the evening. You can take it 1 in the morning, 1 in the evening if you like. I would do that because it helps in a variety of different ways with your metabolism of glucose and your insulin sensitivity. So sea moss, and we have a product, Lipo Sea Moss, that is now available on the website. So go to the website, lipodrops.com, and read about our sea moss preparation. And we brought that to the market because so many people were asking for an option like sea moss. And what you don't want is to get a sea moss product that's not purified, that's not quantified. It says it has 100 milligrams or something. It's got 1,000 milligrams of it, or it has no milligrams of it. It's just listed as an ingredient. So quality of product is very important. At Lipo Drops, we have quality controls. Each batch is tested as soon as it's produced to make sure that it has exactly what it's supposed to have in it. So would you get it, the product is one that you can depend on and gives you exactly what you like. So our sea moss product, if you look at the description at the lipodrops.com website, you'll see everything that's in it because we threw a few extra things in there to help optimize your benefit from the sea moss. So try that, Demon, and give us a report as to how well it's done. We appreciate you. Hello, Mr. Wilson. Okay. Benicia Peterson, female in my early 50s, and I'm overweight and overworked. Well, welcome to my world. Okay, recently my blood pressure has started being elevated. I'm starting to walk. How can I reduce my blood pressure and weight? Walking is also a great aerobic exercise that can increase your metabolism, but you don't lose weight in the gym or by exercise. You lose weight in the kitchen. So unfortunately, at the age of 50, now you're at minimum perimenopausal, probably menopausal. Your metabolism changes, and what happens is when you have good estrogen levels, your body directs fat away from your abdomen to your periphery to support the growing fetus. So you get nice hips, thighs, nice breasts. As you go through perimenopause and menopause, the estrogen is not redirecting the fat now, it's directing it directly to your abdomen. So most people in the perimenopausal menopause age gain about 1.5 pounds per year, which doesn't sound like a lot, except after 10 years, it's 15 pounds. And after 20 years, it's more. After 30 years, it's 30 pounds. And so most people end up being 20 to 30 pounds overweight. So it's not easy to lose it, but it can be done. So you need the full line of weight loss products. And you would probably benefit also from our Lipo Hers, our Lipo Night, which allows you to burn fat at night while you're sleeping. Of course, the world famous, infamous Lipo Drops Maximum Strength formula. You put a dropper full under your tongue before each meal, and it changes the methodology in which your body metabolizes fat. So instead of storing fat as fuel, your body utilizes it as fuel, and what you don't need passes through you. And then fat that has been stored that your body no longer needs, it starts to eliminate. So you start to literally melt. And it particularly focuses weight loss and fat reduction in areas that you cannot traditionally lose weight, like under your chin, across your back in the bra line, the muffin top, your abdominal area. Our catchphrase is lose the muffin top with the Lipo Drops. So full product line would reach every one of those indications that you have. We really want you to take care of that. So thank you so much. We appreciate you for a great question. Okay, my son has a hip injury that revealed fluid in his bone and a worn down tendon. They mentioned autoimmune wanted to give medication that can cause cancer, so we didn't agree. If he's having some lytic lesions, that means that they're hollowing out the bone and there's fluid in there. There are several that can do that. Some of them are malignant, but like multiple myeloma. But there are some things that needs to be evaluated. They can determine whether it's autoimmune or not. It shouldn't be a guess. It should be a definitive diagnosis, and then they can direct the medication to that. Most medications that alter the immune system can make you susceptible to various types of infectious pathogens, and that's why they say don't get vaccines, don't get sick. If you are sick, if you have a history of hepatitis A, B, or C, or if you have a history of tuberculosis, then you don't want to take these medications because they'll blunt your body's immune response, and you'll have a full-blown episode of either of those disease states. But your immune system also is very, very important in the prevention and treatment of cancer. We all have cancer cells floating around in our bodies right now. Our immune system eradicates 99.999% of them on a daily basis. But it's when they get out of control. And that's what can happen. If you mute the immune system response, then cancers can settle in and grow. So that is an option. So I don't want to say it will cause cancer, but it can potentiate a cancer diagnosis. So very important that you do that. Okay, thank you. Great question, Lawrence. Black Beauty One. Is there a safe and natural way to get rid of fibroids without surgery? No. Menopause will do it because once you're no longer feeding hormones to the fibroids, they will shrink. So some people, that is exactly what they do. They just try to hang in there until they're no longer having menstrual cycles, and they are no longer supporting the growth of the fibroids. There are certain progesterone-only types of birth control pills or hormonal therapy that also can shrink fibroids. And then there's actually a new medication that came out about 2 years ago that will directly attack the fibroids as well. But then versus the traditional surgery, which is either a hysterectomy, or which takes away the uterus and the fibroids, or a myomectomy, where you're just removing the fibroids, there's a thing called uterine fibroid embolization, or UFE. This procedure is not done by GYNs. This procedure is done by interventional radiologists. And it is an amazing procedure because what they do, they thread a thin filament into the artery that supplies blood to the fibroid. They put some gel beads inside the artery and block it off so there's no blood going to the fibroid. So the fibroid dies, it shrinks, it liquefies and goes away. This is amazing. There's no substantive recovery time for this. It's outpatient surgery. You go in the morning, you're home by lunchtime, and the fibroids will melt over the next few weeks. And so that is a great way of addressing this. But all fibroids are not eligible for it. They can do an MRI of the uterus to give you an idea and determine. So it's best if you have just one or two fibroids versus having a lot of them. Because if you have a lot of them, really the only real option I would recommend would be a hysterectomy. Just take the uterus out along with the fibroids. So that is the way to do that. There are diets that have been recommended that supposedly help with fibroids. I'm not sure about the science behind that, but there's information readily available on the old internet that you can get and find out. But try and Google UFE. There's a Dr. John Lippman in Atlanta. He's the father of this technology, UFE, and he started a thing called the White Pants Initiative, because when women have fibroids, they oftentimes have bleeds that are unexpected, and so they're always wearing darker clothes because they don't want to have blood showing through their clothes. And so he started this initiative called the White Pants Initiative in cooperation with several of the local urban radio stations here in Atlanta, and it has been a phenomenal program. And so you can go to his website, but his name is Dr. John Lippman, Lipman, and find out about uterine fibroid embolization as well. Okay, great question. Latoya Grant, how do you get rid of inflammation in the body if you have lupus? Lupus is basically an autoimmune disease state that causes inflammation in the body. How do you treat inflammation? With anti-inflammatories. Unfortunately, the most common anti-inflammatory used in lupus and the most successful are steroids. And steroids do work. The problem is that sometimes you have to go to high enough doses and they cause thyroid problems and weight gain. So you want to avoid that if you can help it. But you can also supplement the steroidal therapy with omega-3 fish oil, vitamin D, natural anti-inflammatories, other anti-inflammatories such as curcumin and turmeric, because the lupus is total body inflammation. And every piece of skin, every piece of tissue, every piece of connective tissue, every muscle can be affected by the lupus. Most of the time, it's not all encompassing. It may focus on certain areas, but it can cause inflammation of the scalp, which makes you lose your hair. It can cause inflammation of the facial skin, and the skin becomes light if you're pigmented, and you end up with a rash, a light rash here, a light rash above and below the eyes. They call that a butterfly rash. Very significant and easy way to make a diagnosis of lupus. But again, want to confirm that lupus is what you have. There is no lupus test. So there's no test that says lupus positive or negative. Lupus is a diagnosis of exclusion and a variety of other factors that come in: your history, how you're presenting, and then some of the inflammatory markers that are consistent with lupus. But again, there is no lupus test. I personally believe that lupus is overdiagnosed, and that because it's an easy diagnosis to make. And oftentimes the signs and symptoms are nebulous. They don't respond to traditional therapies. And so the clinician will just say, oh, this is lupus, and give you that. And at least you know what to call it then. And so your expectations for improvement are lowered because you got a diagnosis for something that really can't be treated with a lot of enthusiasm. So natural anti-inflammatories will help tremendously. Again, but I would definitely want to make sure that the diagnosis of lupus is confirmed. Great question, Latoya. Angela Collins. Hey, Angela, how are you? On the Rickey Smiley Show, while discussing prostate surgery, you mentioned a product for men that had prostate surgery. When the wind blows, they're ready. What was that product in conversation? That was my, thank you so much for listening, Angela. You're quoting me directly. Lipo-T is the product we're talking about, as well as bioidentical hormone replacement therapy, or BHRT. Most of my men that have had prostate issues, I place on the Lipo-T product, which is 2 or 3 capsules every day after dinner, before bedtime, anytime after dinner and before bedtime. When they first started, I'll usually put them on 3 capsules. After they've been on it for maybe 3 months, I may decrease it to 2 capsules, and then they can stay on it if they like it, 1 capsule to 2 capsules every day, in addition to the bioidentical hormone replacement therapy, or pellets. That is the generic term is pellets, but each pellet is about the size of a grain of rice, and it can be inserted in the abdomen, on the side of the abdomen where you pinch an inch, or can be inserted in the buttock area just above the sitting area. And again, this is a procedure that Dr. Collier does in his office. If you've had the prostate surgery, and depending upon if it was due for prostate enlargement or whether it's prostate cancer. If it was prostate cancer, you have to have a period of disease-free state. Again, I mentioned before that it started off at 5 years, and then it was 3 years, then it's 2 years. Some people will start a patient depending upon the stage of the prostate cancer, because we have learned that testosterone does not feed prostate cancer. The thought was that since estrogen does feed breast cancers in women, and women are given treated for breast cancer with anti-estrogen therapy, the assumption was that, oh, well, testosterone must do the same thing for prostate cancer in men. Well, that myth was debunked. And then they found out, no, there are only a certain number of prostate or testosterone receptors on the prostate. And once they're full, they're full. So no matter how much testosterone you throw at it, you're not going to have a negative effect on the prostate or increase or enhance the potential for prostate cancer. So now that has been reevaluated, and doctors are now utilizing a hormone replacement therapy in men with a history of prostate surgery, it is literally life changing. So men that were basically told you'll never have sex again, you won't be able to get an erection, are now having full and successful sex lives. So of course they're happy about it. Their partners are happy about it. So you need to have a provider that is up on this and understands this new technology and these new treatment options, because doctors practice the way they were trained. If they were trained 20 years ago, they got a lot of experience, but they also continue to practice the way they did 20 years ago. And so if things have changed, it takes a while for people to get with a new thought process or a new option, particularly when they've been told not to do something for so long. And now they're saying, oh no, well, not only can you do it, but you should do it, and do it with enthusiasm. So that is where we are in this cycle of utilizing hormone replacement in men with a diagnosis of previous prostate cancer. And if a person has had prostate surgery, i.e. the entire prostate removed, then there's no cancer to worry about anyway, because the cancer is gone now. The prostate is gone. If they had other types of surgical procedures, which they can have and do effectively treat prostate cancer, then it has to be evaluated. But either way, regardless, if the person has had the cancer and their PSA is down, and they have basically they're disease-free and have been declared cancer-free, they can have a test of a prostate bioidentical hormone replacement therapy and to see how they respond, or they can just go on it. So I found that as time has passed, more doctors are being more liberal with instituting this type of therapy because you can always stop it. If you see the PSA rising or there's a problem, you can just stop it. And so that most men don't want you to, but if you have to, then you can. But it's rare that you have to do that. Most men respond well and respond in a positive way. Most men and their partners want to have a functioning male member so that they can have an active sex life. It's a part of a relationship. And when that is taken away, it changes the nature of the relationship. Snuggling and holding hand and kissing is all good, but most men and women want to be able to have a fully satisfying sexual relationship as well. So great question, Angela. Pass that information on. When the wind blows, you'll be ready. Okay. Resiah Renee, weakness, numbness, and tingling from shoulder down to fin with neck pain. Recently diagnosed with spinal stenosis, C3 through C7. Surgery is strongly recommended to release cord compression. How serious is this? Renee, this is very serious, but again, this surgery is becoming very common. In the past, I have been quoted as saying, nobody is operating on Dr. Collier's neck or Dr. Collier's back unless, 1, I can't walk, 2, I can't control my bowel or bladder, 3, I cannot function and get an erection. Those were my criteria. Can't walk, can't control bowel or bladder, can't get an erection. Well, that's changed. I have to admit, the technology has improved so tremendously. What spinal stenosis is inside the neck bone, the vertebral bones of the neck. There are 7 C-spines, C1 through C7. They're hollow in the center, and the nerves that go all over your body, they come from your brain, they go down in a bundle through that space. Sometimes due to degenerative bony changes, arthritis, just small hole, whatever, that space can be compromised. The spine should be free floating in spinal fluid in that space and able to move around and adjust. If that space becomes compromised and it starts to put pressure on any point in a bundle of nerves, you're going to have shooting pains, stinging pains, pins and needle sensation, feels like it's on fire, feels like it's numb. It can be any of those things. It can be all of those things. And if it affects the muscle fibers or the movement fibers, you got sensory nerves and motor nerves. If it affects the motor function, then you start to get loss of function. You decrease range of motion, can't move your arm. That's when you really have a big problem. So nowadays, this surgery, and they do it usually from the front. They go through the front of your neck to get to the back of your neck instead of cutting down. But they can make a posterior approach as well. It depends. And they can go in, they can physically just go in and scrape. The old school was just literally a hammer and a chisel. Thank God we have gotten away from that, because I don't think a human's hand can control a hammer and a chisel on a millimeter to millimeter basis, which is what we're talking about. One slip and boom, you paralyzed. So you don't want to deal with that. But they now have laser options where the laser, they can aim the laser at the bone and zap it. It just vaporizes and it's gone. No damage to the nerves there, and other techniques as well. So the therapy may require them to put some screws and or possibly a cage in your spine to stabilize it. It just depends. But I would go with a provider that has lots of experience in doing this. You don't want to be the first person they've done since they took a training class in Las Vegas at a convention. I would want somebody that's done this, done it many times, and had great success with it, and you'll probably have a good outcome. I have physician friends, at least 2, both who had, one male, one female, that have had this surgery and had great responses to it. Perfectly normal at this point. No restrictions, no problems, doing everything they want to do. So I'm glad to see that has happened and that the technology has improved so much for doing that. So good luck with this. Again, make sure that you are getting the best of the best as far as your surgeon is concerned. And let us know how you do with this, Renee, because that is really the only real option once you get to that point. Me Witcher, should I be concerned with black and purple veins and bruises on my legs? That is a genetic predisposition issue most of the time, all of the time. They're superficial. It's just cosmetic. You don't like the way they look, but there's no danger of clotting or anything like that. It's when the deeper veins can become varicose or varicosities. It's where instead of being straight down, they got a lot of curves and squiggles in them, etc. That decreases what's called laminar flow. So the blood does not flow easily. And when blood does not flow, what does blood do? Blood clots. And when you get a clot, you have a problem. But there's no problem with superficial veins clotting. There are treatment options for that. There's a whole system of treatment places called Vein Clinics of America. They can do that. A lot of dermatologists and plastic surgeons can do them as well. There can be injections in the veins of a hypertonic saline solution that irritates the inside of the vein. They take it and put a compression bandage on there to squeeze it down. It sticks together, then it's closed off. They can sclerose the vein, either using electrocautery or chemical sclerosing, which does the same thing. They can cut the vein out. So there are various ways to treat it to give you, one, a good cosmetic look, and one, stops you from having those black and purple veins and bruises on your legs. That's a great question, Mimi. Cornelia Belcher, do you have to do anything else along with taking the max drops? Yes. Again, the thing that it comes with a diet program that includes one of two options. One option is eating 5 meals per day. That means breakfast, lunch, and dinner, a snack in between breakfast and lunch, a snack in between lunch and dinner, which is always more than the person is eating. And they say, I'm not eating that much now. So why do I have to eat 5 times per day? That is why. Because your body, when you don't eat that way, your body goes into a starvation phase, and it says, well, I don't know when the next time I'm going to eat. So what I'm going to do is store some of this fuel or food that I just have eaten and turn it into fat so that I'll have a readily available fuel source when I need it. So when you eat 5 times per day, your body never goes into a hunger phase. You don't feel hungry. And your body says, hey, I have fresh fuel that's coming in every 3 to 4 hours, which is what that schedule means. So I don't need to store food as fuel because I have fresh fuel, which I'd rather use for my day-to-day activities than stored fuel, because it's difficult to convert fat back to energy. It's a process that your body doesn't like to do, but it will do it when it has to. So it stores the fat. So initially, your body says, hey, Cornelia, she's doing that, so we can stop storing fat because she's eating. Now we have fuel. Then after a couple of weeks, it takes usually about 2 weeks, your body says, hey, Cornelia, you're serious. Not only do we not need to store food as fuel or fat, we can let go of the fuel that we have stored because we have fresh fuel coming in. So at that point, that mechanism is turned on and you literally just start to melt. So the first couple of weeks, you'll lose weight, but not like you will after you've been doing it for a couple of weeks, because your metabolism readjusts and you start to literally just release the fat that's been stored. And it is a dramatic process. Some people become afraid of this. I'm losing too much too fast. No, you aren't. That's exactly what's supposed to happen, but you have to maintain that, because if you go back to eating 1 or 2 meals a day, which is what most of us do, with some dirty, sneaking snacking in between, then that's what makes your body want to store fat. Now, the other option is intermittent fasting. Intermittent fasting means eating everything that you're going to eat within 1 8-hour period. That can be 9 a.m. to 5 p.m., 10 to 6, 11 to 7, whatever works for you, but try to stay within the same 8-hour time frame every day. So you can't do 10 to 6 one day and 7 to 4 the next day. It doesn't work that way. So if you do it consistently, then, and it almost really doesn't matter what you eat. And people are shocked when I say that. Now, that doesn't mean you can live on Krispy Kreme donuts and French fries all day, every day. But what you can do is, again, you will find that you will just lose the weight if you eat reasonably well. Most people do eat reasonably decently. Sometimes we snack on things that we know to excess, but most people literally do eat reasonably. If you eat reasonably in that 8-hour period, you will find that you have no difficulty. One, you're not hungry, and you lose weight. It just happens that way. So what the LipoDrops Maximum Strength Formula does is allow your body to metabolize food in a different way. So the food is not stored as fat, it is metabolized as fuel, and then what you don't use, you pass through and you lose weight. So that is one of the options. But if, depending upon how much you want to lose, number one, number two, how quickly you want to lose it, you may want to use more than just the LipoDrops. You may want to use the Lipo Nights, which is our new product, which allows you to burn fat while you're sleeping. And it also has melatonin in it so that you get a good night's sleep. Because when you get a good restful night's sleep, your body will lose weight. When you're tossing and turning and not getting deep restful sleep, your body kicks out that deadly hormone cortisol. Cortisol causes you to store fat in your abdominal area in particular. So you don't wake up rested, you're stressed, and now your belly is growing. And so that stops that from happening. So they are good complements to each other in reference to weight loss. There are also some lipolytics in the liponites to help you burn fat in a more traditional way. So, but the melatonin is just a bonus that we threw in there, and we found out that it makes a major difference because you're sleeping well, you're not getting the cortisol effect, and so your abdomen will just start to shrink. So lose the muffin top with Lipo Drops. Go to the website lipodrops.com and also go to my YouTube channel, Ask Dr. MJ, and a lot of videos and information on these topics that will explain this in greater detail. Thank you so much for tuning in. Great question. Robin Breenan, I was diagnosed with an autoimmune disease. My doctors want to place me on Humira, and I'm really scared. Is that medication safe? Robin, that is one of the greatest drugs ever invented. It was originally indicated for rheumatoid arthritis. And it is a biologic. It's what I've been talking about all show. It's a new class of drug. It's a biologic. It calms down the immune system so the autoimmune symptoms don't manifest themselves. But what they found out was that there are a lot of other diseases that benefited from the Humira, like irritable bowel syndrome and Crohn's disease. Now you see commercials for Crohn's talking about this class of drug. There are at least 4 or 5 of them on the market now. Humira is very good. Depending upon which autoimmune disease you're talking about. But again, if for whatever reason you did not like it or you had side effects from it, you can stop it. There's no permanent effects to it. But any drug that alters the immune system can cause you to be more susceptible to infection. So you have to be very careful and conscientious. You can't hang around with people that are coughing and sneezing or sick people in general, because your body won't have the ability to fight those infections as well. It doesn't stop the immune system. That would be a really bad thing. So you still get some immune function, but it's just muted, so to speak, to keep the autoimmune symptoms under control. So that has been a miracle drug for a lot of people with diagnosed autoimmune diseases. And I fully expect new indications to come out for virtually every autoimmune disease at some point, because these drugs work in the broad spectrum. I like to call them hoop skirt. If you remember the movie Gone with the Wind, where all the ladies had the tiny waist and then they had the big skirts, they call them hoop skirts, because hoop skirts cover everything. Well, these medications cover everything, and they cover a lot of disease states that are inflammatory in nature and autoimmune as by design. So I would say try the Humira, and I think you'll be really happy with the benefits that you get from it. And again, just monitor your susceptibility to infection. When you're around people in crowded areas, you might want to wear a mask. I recommend that anyway under some circumstances. But I don't want you don't have to be a bubble girl, Robin. You still will be able to function and go out and do great things. So you'll find that, but your autoimmune disease state will be well controlled and compromised. So I'm glad to see that your physician offered that to you, because a lot of doctors don't, because they don't understand it, don't want to use it. And when they don't do it, they just don't recommend it. So I'm glad that your doctor is state of the art and on top of these things and offering you the best therapy option that's available for that disease state right now. Great question, Robin. Okay. Rickey Slaughter, 61-year-old black male who just had a trip about 3 weeks ago. What should my next step to health be? One, once you have gotten through your healing period, you're only 3 weeks in. I think it takes about 6 weeks before they recommend. I would recommend you got a TERP is basically where they open up the prostate from the inside. They go through your urethra, through the penis, and there's several ways they can do it. They can do it with a thing called aquablation, which is like a really high-powered water pick. They can do it with microwave therapy. They can do it with electric cautery. They can do it with a manual scraper where they just go in and scrape out the prostate tissue. So that old school technique is still one that's utilized by doctors who don't use the laser therapy. So once you have done that, I would recommend that you want to optimize your ability to function. So my Lipo T product would be a perfect supplement for you. And then you should not have any, the TERP rarely affects your ability to get an erection. You're only 61, so you should have no difficulty doing that. Lipo T will help with that if that is indeed an issue for you. And then once you start using it, about another 3 weeks now, then frequent intercourse. You need to have intercourse a minimum of 2 times per week. You cannot have it too much. 2 times a day is not too much, but 2 times a week would be the absolute minimum to optimize prostate health, because you still have prostate tissue there. and that tissue can regrow and fill that space in, and you can have a big prostate, again, benign prostatic hypertrophy, which blocks your ability to pass your urine and causes problems with retrograde ejaculation, etc. And so you may notice when you first start to resume sexual activity that when you have an ejaculation that you're not seeing a lot of sperm because it's going backwards. It takes the path of least resistance, which is back up into the bladder. And then when you urinate, it'll come out. The good thing is that doesn't mean anything. It feels just the same. So you still get the joy and the thrill and the benefit of having an orgasm. You just may not see a gush or a gurge, which is what a lot of people do want to see, but that's just sometimes not an option when you've had a TURP procedure. But I would resume sexual activity as soon as it's safe to do so. I would take a supplement like my Lipo T. Not a bad idea to try maybe a daily dose of Cialis as well. They have the 5 milligram daily dose of that, or you could take intermittent therapy with the 20 milligram dose of Cialis or the 100 milligram dose of the Viagra, having sex a minimum of 2 times per week. So that means getting 8 to 10 pills per month and utilizing that. That was a challenge previously, but those medications now, $2 a pill, if that much. Sometimes you can find them for $1 a pill. So it's not expensive at all. When they were $59 a pill, that was an expensive evening. But, you can find them generic versions of $1, no more than $2 per pill. And at the local pharmacies, and you don't have to hunt for it now like you used to. But good places to get them. Costco, Sam's, all the warehouse stores have them at very, very good prices. Okay, that was our last question. Let's send everybody. I want everybody to go to the website, lipodrops.com. We have some good information on there. We got some special marketing tools, some commercials that you'll see on there that are very informative as to the benefits of taking this lipo products. I want you to spend some quality time on the website to see all the things that we offer you, because we got the weight loss services, we have the immune services, we got services just to benefit you in a variety of different ways. Dr. Collier's Essential Trio, taking the probiotics, the omega-3 fish oil, and the vitamin D every day. Every day I take these, and I believe that they have added probably 10 years to my life, but not just added 10 years, but quality years. No Alzheimer's disease, good erectile function, again, healthy skin, healthy hair, all of these things, benefits. I highly recommend that. But there are products that are available that you would benefit, or a family member would benefit, a spouse, a significant other. Just read and inform yourself and see, because this is a very unique place. There's no place that has comprehensive healthcare supplements available like this for a variety of different things. There are places that you can get something for weight loss, or something to boost your immune system, or something to help overall health. But we got it all in one site. So take full advantage of that. Remember, ladies, if you're over 40, you're starting to get that perimenopausal, menopausal fat retention, gaining anywhere from 1.5 to 3 pounds per year. Before you know it, you're 20 to 30 pounds overweight, and most of that is in the abdominal area. Lose that muffin top with the lipo drops. You can zap that belly fat away right now. You don't have to wait until it's too big. You can lose that weight. You can tighten that chin up. Don't worry about a sagging chin on a turkey neck. You can get that, instead of having to squeeze those bra straps in around your shoulders and around your back, you'll find that your bra is fitting you more comfortably now, because you don't have all that cushion and back fat that we talk about all the time and laugh and joke about on the Rickey Smiley Morning Show. Those are things that you want to do. And look, we want you to tune in every Wednesday for Wellness Wednesday. We air at 8:20 Eastern Standard Time on the Rickey Smiley Morning Show. You can tune in, because I am your medical ready reference. This is Dr. MJ Collier, host and on-air personality of the Ask Dr. MJ, Your Health is Important radio broadcast. And we are going to close the show out. Let's see if we can get our music going. Yes! Thank you so much for joining us this evening. It's always my privilege, my passion, and my pleasure to serve as your medical ready reference. We are so glad that you choose to tune in. But not only that, we want you to tell all your friends to tune in. We want you to share with your family members. We have listeners in Africa, Asia, Canada, North, East, West, and South, California, New York, New Jersey, Midwest. Why? Because people want medical information. People want to know how to stay healthy, what they can do to remain healthy. And that's what we're offering you. We're offering you medical information in the format we call infotainment. So thank you for being here tonight. We appreciate you, and we'll see you next time. Tune in to Rickey Smiley Morning Show and go to my